this is Emma Hitt-Nichols, and this is the information on the latest US FDA approvals for the week of October 23rd through 27th, 2023. That's last week. The FDA has approved Loqtorzi, that's also called toripalimab-tpzi, and that's a next-generation PD-1 monoclonal antibody that has two indications for nasopharyngeal carcinoma, NPC. The first is use in combination with cisplatin and gemcitabine as the first-line treatment for metastatic or recurrent locally advanced NPC. The other is as monotherapy for recurrent, unresectable, or metastatic NPC, regardless of PD-L1 status, and that's after platinum-containing chemotherapy. The approval is based on data from the Jupiter-02 Phase 3 study showing that Loqtorzi significantly improved progression-free survival with a 48% risk reduction and an overall survival of a 37% lower risk of death when combined with chemotherapy. While the safety profile aligns with other PD-1 inhibitors, the Loqtorzi arm had more adverse events than chemotherapy alone. In patients who had previously failed chemotherapy in the Polaris-02 study, Loqtorzi demonstrated promising anti-tumor activity with a 20.5% objective response rate, a 40% disease control rate, and a median overall survival of 17.4 months. Loqtorzi, which is manufactured by Coherus and Junshi Biosciences, is expected to be available in the United States in early 2024. Also this week, the FDA has approved Vabysmo, that's also called faricimab-svoa, as a treatment for macular edema following retinal vein occlusion, RVO. And this is the third approved indication for Vabysmo. This bispecific antibody, the first of its kind, granted FDA approval for eye-related conditions, targets angiopoietin 2 and vascular endothelial growth factor A. Vabysmo has previously gained approval for wet AMD and diabetic macular edema, conditions that impact approximately 3 million patients in the U.S. Two global phase 3 studies, Balaton and Comino, supported the latest approval. Faricimab or Vabysmo demonstrated early and sustained vision improvement in patients with RVO, meeting the primary endpoint of non-inferior visual acuity gains at 24 weeks compared to aflibercept. Faricimab also rapidly dried retinal fluid and exhibited a generally well-tolerated safety profile, with conjunctival hemorrhage as the most common adverse event occurring in 3%. The latest approval was granted to the manufacturer Genentech. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Just visit nascentmc.com. That's nascentmc.com, NASCENTMC as in medical communications.com. Nascent Medical's team of native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and much, much more for the price of what a single freelancer might charge. But at Nascent, we have freelancers who are always available and have the exact background and experience in the specialty you need for your project. Just visit nascentmc.com for an immediate quote during business hours, Eastern Daylight Time, EDT. Nascent Medical, you never have to be without excellent medical writing help. Also this week, the FDA has approved mirikizumab-mrkz, that's also called Omvoh, to treat adults with moderate to severe active ulcerative colitis, which is a form of chronic inflammatory bowel disease. Omvoh is the only ulcerative colitis treatment that selectively targets the P19 subunit of IL-23, which plays a role in inflammation related to UC. The approval was based on results from the LUCENT program, which included 2 phase 3 clinical trials consisting of one 12-week induction study and one 40-week maintenance study for 52 weeks of continuous treatment. All patients in the LUCENT program had previously been treated, including with biologic treatments that did not work, stopped working, or that were intolerable to the patient. The approval of Omvoh follows a setback in April of this year when the FDA initially declined clearance due to manufacturing-related issues. The approval was granted to Eli Lilly. Mirikizumab or Omvoh will be available in the United States in the coming weeks. Also last week, the FDA has approved Vamorolone, that's also called Agamree oral suspension, 40 milligrams per milliliter, and that's a novel corticosteroid treatment for Duchenne muscular dystrophy, or DMD, in patients aged 2 years and older. In clinical trials, Vamorolone met the primary endpoint of time to stand velocity compared to placebo at the 24-week follow-up of the Vision DMD phase 2b study and exhibited a favorable safety profile. DMD affects approximately 11,000 to 13,000 individuals in the U.S. and leads to muscular function regression, ambulation loss, respiratory failure, and ultimately death. Vamorolone targets both glucocorticoid and mineralocorticoid receptors. In DMD, Vamorolone is thought to work by reducing muscle inflammation and atrophy, promoting muscle regeneration, and protecting the heart from damage. Common adverse events include mild to moderate cushingoid features, vomiting, and vitamin D deficiency. Vamorolone, manufactured by the Swiss-based company Santhera Pharmaceuticals in partnership with Catalyst Pharmaceuticals, previously received orphan drug and rare pediatric disease designations and will gain 7 years of orphan drug exclusivity following this approval. Vamorolone is expected to be available in the first quarter of 2024. Also last week, the FDA has approved ivosidenib-Tibsovo as a treatment for adult patients with relapsed refractory myelodysplastic syndromes, NDS, carrying a susceptible IDH1 mutation as confirmed by an FDA-approved test. The agency has also approved the Abbott real-time IDH1 assay as a companion diagnostic device to aid in patient selection for this treatment. This decision is based on the results of a clinical trial involving 18 adult patients with relapsed refractory MDS harboring an IDH1 mutation. In addition to complete responses, a significant proportion of patients achieved transfusion independence. Ivosidenib was generally well tolerated, with the most common adverse events being manageable. Notably, the label includes a boxed warning for the risk of differentiation syndrome. In addition to MDS, ivosidenib is also approved for certain forms of IDH-mutated acute myeloid leukemia and metastatic cholangiocarcinoma. The approval of ivosidenib was granted to Servier Pharmaceuticals. And finally, this week, the FDA is reviewing AstraZeneca's application that would allow patients or caregivers to administer its nasal flu vaccine, FluMist quadrivalent. If approved, this vaccine could become the first self-administered flu vaccine, eliminating the need for healthcare practitioner administration. FluMist was initially approved by the FDA in 2003. AstraZeneca anticipates a decision from the FDA in the first quarter of 2024, with plans to make the vaccine available for self-administration in the U.S. during the 24-25 flu season, providing it receives approval. The supplemental application is supported by data from a usability study which confirmed that individuals over 18 years of age can successfully self-administer or administer FluMist to eligible patients aged 2 through 49 years when provided with instructions for use without the need for additional guidance. All right, that's it for this week. Thank you so much for listening, and I hope you have a great week, and we'll be back next week. Thanks so much.